Thank you for the opportunity to present this work. My colleagues and I do not have any disclosures related to this study. Reverse shoulder arthroplasty, or RSA, has a geometry that leads to high shear forces and bending moments being applied to the glenosphere base plate and the screws that attach the base plate to the scapula. Because of this loading, fixation stability is challenged, especially in patients with reduced bone stock due to posterior glenoid erosion. For instance, those classified as having a Walsh type B2 or B3 glenoid, as you can see in these two images. Two techniques have been developed to compensate for this bone loss. We have Augmented RSA, or AUG RSA, as you can see in the bottom left, which is an all-metallic base plate with a wedge-shaped profile. We also have the Bony Increased Offset, or Bio-RSA, seen in the bottom right, where we have a traditional cylindrical base plate with a wedge-shaped humeral head autograft to reconstruct the bone loss. The goal of this study was to investigate the level of micromotion experienced by the AUG and Bio-RSA techniques, and we hypothesized that there's no statistically significant difference in the initial fixation stability between the two techniques. In this study, we collected preoperative CT scans from 9 patients with B2 or B3 glenoid erosion that underwent RSA, and we used each of these 9 to create AUG and Bio-RSA FEA models. Our modeling workflow was we took our patient CT scans into materialized mimics, created a 3D model, which we then imported into SolidWorks to undergo a virtual implantation. This modified model was then imported back into materialized mimics for heterogeneous material properties to be assigned to the bone. We then took the scapula model along with the implant construct models into Abacus, where we constructed our finite element models and conducted our simulations. For each of the 18 models, we performed a virtual implantation, as I said, and this was done by a fellowship-trained shoulder surgeon. Both the Augmented and Bio-RSA models had identical wedge angle, baseplate diameter, construct thickness, and screw placement. However, the Bio-RSA used a 25mm central post, as described in the surgical manual, whereas the AUG-RSA used a 15mm post, as chosen by the surgeon during the virtual implantation. Both used anterior-posterior compression screws and superior-inferior locking screws that were modeled with accurate thread geometry, as you can see in the two images below. The scapula models were meshed using tetrahedral elements with an average edge length of 1.5mm, and these were assigned heterogeneous trabecular and cortical bone properties using the equations seen here, which are drawn from the literature. The base plate and screws were titanium, and so were assigned the material properties shown here. The bone to implant coefficient of friction was assigned to 0.74, whereas the graft bone to scapula bone coefficient of friction was assigned to 0.91. The screw thread to bone interaction was given a coefficient of friction of 0.3. And importantly, the locking screw heads were tied to the base plate in order to mimic that locking mechanism that exists in reality with these screws. The compression screws were given a head to base plate coefficient of friction of 0.357. The compression screws were then preloaded with 160 newtons in Abacus, and this value was drawn from previous literature. After applying the screw preload, 756 newtons of compression were applied, as well as 756 newtons of superior shear load to each of the base plates. In terms of data that was collected, we measured the micromotion between the augmented base plate or the bio graft and the reamed scapula bone, and we calculated the tangential and normal displacements using the Abacus C-slip and C-open variables, as you can see in these two images. Micromotion was then grouped into the 4 quadrants, and each quadrant was averaged. For each quadrant, we made a comparison between the Augmented and the Bio-RSA using a student's t-test with significance set at p less than 0.05 for both tangential and normal displacements. So first, looking at the tangential micromotion with the 4 quadrants along the x-axis and the micromotion in micrometers on the y-axis, we see that in all quadrants, the micromotion is less than 20 microns for both constructs, and the only statistically significant difference was the Augmented RSA having more micromotion than the Bio in the superior quadrant. In terms of normal micromotion, we have the same axes, and again, we found that all of the average micromotions for both constructs were less than 20 microns, with the maximum occurring for both constructs in the inferior quadrant. The only statistically significant difference was again in the superior quadrant, and in this case we found that the Bio-RSA had more normal micromotion as compared to the Augmented RSA. So what do these results mean? Well, first of all, the calculated magnitudes of tangential and distractive micromotion were well below the 50 micron threshold thought to begin to affect bone ingrowth. The peak tangential micromotion occurred in the posterior quadrant for both constructs, and this may be due to the eroded bone stock, which limits the amount of thread engagement that we have, and thus the fixation that we have in that posterior quadrant. And that is true for both of the constructs. Peak normal micromotion for both techniques occurred in the inferior quadrant, as predicted by the rocking horse mechanism. And if we compare our results to previous studies, such as that by Denard et al., who performed bio-RSA in an FE format as well, our micromotion is much lower. They found 351 microns for the bio-RSA. However, in their FE study, their models used foam instead of bone, and there was no cortical shell. As well, there were fewer screws, and the screws did not have any compression preload, all of which contribute to higher micromotion in their study. This study does have some limitations. First, we weren't able to do a direct experimental validation because we needed to use patient CT scans that had the right kind of glenoid erosion, and it simply wasn't possible to find cadavers that had that type of erosion. In terms of strengths, the simulations in this study have incorporated a number of characteristics not employed in previous studies, which increase the physiological accuracy of our results. This includes the use of accurate screw thread geometries and the simulation of compression screw preload. So in conclusion, this is the first work to directly compare the augmented and the bio-RSA. Although some of our findings were statistically different, because of their small magnitude, it's unlikely that the performance of these two constructs can be considered clinically different with respect to initial fixation. That being said, some future work could be to undertake an investigation of bone and graft loading in order to assess the likelihood of resorption with these two techniques. Thank you for your attention. If you have any questions, please feel free to reach out to me via email or on my Twitter handle, which you can see in the bottom right here. Thank you.